This video demonstrates how you should initiate gait training in a patient with good sitting and standing balance following a stroke. Gait training should be promoted from the beginning so that the patient develops a symmetrical walking pattern with weight bearing on the affected leg. Using a walking aid should be discouraged unless essential. To improve the patient's sitting balance, ask the patient to hold the arms extended and bend sideways, forward and backwards. The patient should have sitting balance to commence this step. Hold the extended arms together and move to the edge of the chair. The physiotherapist should be always on the patient's affected side and should support the patient's affected upper limb. The affected foot should be placed behind the unaffected foot. Bend the trunk forward while maintaining the balance. If required, support the patient to stand from the sitting position. Firstly, maintain the patient's balance on the affected side and transfer the weight in standing position by sound leg stepping forward and backward. Remember to avoid hyperextension of the knee joint and avoid knee locking in stance phase of the affected leg. Move your pelvis forward over the affected leg. To improve the patient's standing balance, swing the patient with the support of the physiotherapist. The patient needs to control the hyperextension of the affected knee when putting his foot down on the ground. That means avoiding back knee. If all this is first practiced while in the standing position, patient will develop a better walking pattern than if he is made to walk immediately without the necessary control of his leg. Encourage the patient to walk with the correct gait pattern. The emphasis should be given to achieve hip flexion, knee flexion, and ankle clearance in the swing phase while minimizing the spasticity. Analyze the patient's difficulties during walking. In stance phase, excessive core contraction of both extensor and flexor patterns inhibits the movements. This allows the patient to take weight on the affected leg, but it makes the limb less mobile. Therefore, only moderate degree of core contraction is necessary, which gives stability to maintain the posture against gravity. In the swing phase, moving the weight-free affected leg for making a step with a mobile knee so that he does not use circumduction at the hip with the pelvis pulled up to the affected side.